Yeah. No, like a man. I feel, no different what I did when I felt when I was 30 or 40 years old. It just puts you back in the driver's seat. That's the easiest way I can explain it. It puts you in the driver's seat, makes you feel that you got control over your life again, and anytime you feel like having sex, you can have it. And you don't feel like you've been done in, or you got to do this process and do that process and see this guy, and yeah. So you definitely, your confidence is back. It gives you full confidence, and what's nice is, as I say, I mean, nobody will even know that you got the device in. I mean, when you do sports, or you work where you shower collectively with guys, there's no difference whatsoever, you know. And you know, depends on what your outlook is, but definitely you feel that confidence, and you can then again get into a conversation whichever way it goes. Yeah. Basically, from age 20 to 30, I was fairly well sexually active, no problems, no erectile problems or anything like that. But from 40 upwards, I had what you call a venous leak. All right, so I had this venous leak, and I wasn't able to maintain erections. It was for the first few minutes and that, and obviously it was quite disastrous for my marriage. It was really very hard for my wife and myself. I then I tried Viagra, I tried Cialis, I tried all those and I tried the injections, and it really wasn't as successful. It really was very bad. So, then I sort of went on. I just want to see if I can plug this in. Then I went on to apply for this operation, and it was very difficult for me. Financially, it wasn't. I couldn't do it. Let me see if this is what. There we go. Yeah. So financially, it was very, very difficult for me. So I then applied through my medical once, and it was turned down because my medical doesn't pay for that kind of operation. So I lost all hope. I'd done all sorts of research and wanted to go overseas and did everything you can think of. And per chance, I applied again through my medical, and by some miracle, they agreed to pay for this operation. So my local specialist did the operation, and yeah, and it's the op was a complete success, and it's been about what I'd say a year and a half, and I can only say that it's been extremely successful and very rewarding. But I definitely can recommend it. I mean, the product is absolutely everything that you guys have said it is, or that Coloplast has said it is that. So yeah. Only if I think of what I went through, I can only sympathize with men, young and old. I mean, as I say, what I did leave out is okay, to go back a bit more, if you don't mind. After the Cialis and the injections, I went for I did hormonal injections. What do I call it? You know, to injections to push up the hormones, and that's what actually caused the cancer. It caused prostate cancer, and as a result of that, I started also yeah, after the venous leak. I had that op that was successful, had erections, but then started losing it again. Got the injections, and that caused the prostate cancer. And then I had to do radical prostatectomy. And then, as I say, from there on, then had the op. Yeah. very, very dangerous, you know. And the thing is, you know, as you say, and every advertisement or everything you look at is such a false promise, you know. It really, you know, the only thing it does is push up your blood pressure. You know, specifically if you're a married man and you know you've had your kids, I've got wonderful children, wonderful grandkids, and you know when you've had that, then you know one wants to get on in life, and yet you don't want to leave your sexual life behind, you know, and you don't want to say okay goodbye to that as well, you know. So this is where this came into being, and yeah, it's really been a great success, you know. Yeah. No, the recovery was, you know, as I say, it was, I think the first 6 weeks was still very tender, you know, and then, uh, you know, as I say, after that, after everything had healed, I was battling to pump it. I was battling to get the pump. The pump is there's nothing wrong with the pump, but I battled to actually pump it, you know, because it's a new device, you know. And then also to deflate it was also a problem for me, you know. I actually then went back to my specialist and he showed me again. And after that, after a few practices, it was like second nature. It was quite normal, you know. And so yeah, from up to full recovery, I'd say about what 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 about 4 months, 4 5 months, and I was ready to go. Yeah. Yeah, as I say, you know, I had the practice key ring, you know, but I mean that's it's a totally different thing when it's inside of you, and you got to try and practice it, you know. So, but yeah, you know, as I say, eventually, you know, I got, at first I did get a bit despondent. I thought, you know, wow, how's it really going to work, you know? But I tell you, it's absolutely a great success. Yeah. Well, I tell you again, you know, I don't wanna sound like this great talker because you get the guys, but my penis was a little bit shorter, I'd say, but a lot thicker. You know, the girth was definitely pleasant, surprisingly enough for me. You know, it was quite great, and also the other thing was, you know, my climaxes have been absolutely more intense than before. That was something I found quite a surprise, you know, because you know what the reviews you read and what people say and that, you know. And honestly, as from a personal point of view, it's quite, you know, quite intense. So from that point of view, both those points has been a great plus for me as well. You know. Yeah, no, you know, I must say my wife has been incredibly supportive and incredibly, you know, sympathetic and was willing to help in any way that she possibly could, you know. Obviously we couldn't have sex the way we wanted, or we couldn't have sex because I mean it was you know it was just not there. So yeah, that so, but it was very hard in the beginning, and it did put a bit of a strain on the marriage. My wife never put you know, she never sort of put pressure on me, but I could see that it did take its toll on her. You know, it was hard for her. You know, so yeah, that was that from that point of view. I must say, my wife has been in it with me from you know from even when I went for the prostate op. We both went in and we both made that decision. And you know, there were a few options. There was the seeding. There was the you know then the operation itself. You know. To do the radical, and we both just decided, look, do the op, go for it, and so on. You know, the op itself was not a great success. The nerve sparing was a disaster, and the doctor that did it actually immigrated to Holland. You know, to Canada, sorry, and you know that was it. You know, we could see he was pushing to get this op done. We didn't realize what his reasons were. You know? So I know that nerve sparing sometimes isn't always that great of a success, but I mean, there has been. I mean, my brother had the same op, but from a different specialist, and he was able to regain erections after his op, you know. So that to me was a tremendous disappointment, I must say, you know. And that was why for about 2 years, I mean, there was just we just couldn't have sex. There was just nothing, you know. And you know, I mean, it's you know, it's very difficult to try and explain to someone what the emotions are. You know, when you know that there's something that you've always had, and when that was gone, I mean, it was incredible. And like that, fortunately, we got a very good marriage and a very good relationship. Well, I mean, what 47 years later, still going. You know, so yeah. Yes, certainly. First of all, look at yourself in the mirror and be honest with yourself. Be honest with your feelings. Be honest with what you really want. And then, secondly, evaluate your marriage. Find out what is your, where are you at in your marriage with regards to your sexual relationship? How sexually are you active? How much do you really want to know? But how important is your marriage to you? And what do you intend to get out of it? And once you've answered all those questions to yourself, you then go and see your medical doctor, your doctor, and you explain this thing to him. And he will definitely, which that's what I did, he definitely then will advise you to go and see a urologist. And there again, don't, go and see the urologist, but don't take his opinion firsthand. Get a second opinion. If I had done that, I wouldn't have had the problems I had, So go to get a second opinion. And then what a urologist will do is, examine you. You'll do a rectal examination and a PSA examination, a test, and then he will have the device ready for you, the Coloplast device. Well, I think there are two on the market. And he'll show you the devices, how it works. What he does is goes through the whole process with you. And then it's, then go to your medical, if your medical will pay for it. And I can tell you, if it's that important for you in your marriage, take a second bond on your house. I'm telling you, that sounds ridiculous, but that's as important. It depends on what you want out of your marriage. Because sometimes, as you say, guys tend to want to just give up the marriage, and then what are you going to do anyway after that? So yeah, it's important that you follow the process through, like I did, until where you now can't, and it's financially either viable or you cannot do it. But then there is a way out always. So that would be my advice, and as I say, and also if you find it difficult to go that route, then go for counseling. Go to a counselor and explain the situation, and let them take you through the process. There was a stage where my wife and I went for marriage counseling as well. So that also helps a lot. But my advice is just don't leave it. Just don't walk with the process and, live this bitter life feeling sorry for yourself. If I think of if I had a support group or if I had someone to talk to, I think it would have helped me quite a lot as well. So that's why I'm more than willing to help someone, chat to someone and advise them, and, So that definitely, I'm quite available for that.